Do I need to continue clinical supervision once I go into private practice? So, our field is really set up that when you are first starting out, you get clinical supervision, right? When we call it a registered intern here in Florida, other places call it other things. You have supervision for usually 2 years. Some places do 3 years. People have, different states have different requirements, but you have to have supervision in order to get licensed, right? And so that's built right in. Usually when you first start out and you're doing, your practicum or whatever it's called, you get supervision there, then you get licensed. And then a lot of the times if you work at an agency, supervision is just linked right into that, right? Whether it's weekly, biweekly, monthly, there is usually supervision. When you go into private practice, supervision, for the most part, I'll talk about some cases where that might not be, is going to be entirely up to you. Unless you're in a group practice where they provide supervision, it's really going to be up to you. And even if you're in a group practice that provides supervision, you may decide, that not that you don't want to do it, but it's not mandatory, right? Like when you work at an agency, it's like, we used to have our supervision meetings. I think they were like, 10 o'clock on Fridays. Everybody went, everybody knew, like that's what it was. But when you're in private practice, it's really easy to blow off supervision sometimes and say, I have a client, or I have to make a doctor's appointment, or I have this, or I have that. And then you find yourself without supervision for a month or whatever period of time. So my recommendation is that you continue to do supervision at some level. You get to decide what that level looks like for you. Now, for instance, if you're going for, let's say you're going for an EMDR certification, you're going to be getting consulting on a regular basis. You might decide that you don't want to do, other supervision. But if you don't have a lot of support, if you're a solo practitioner, if you're thinking about just going into solo practice, you in your office by yourself or you virtually by yourself, you're going to want support. You're going to feel lonely. That's one of the biggest complaints that people talk about in private practice, is that they feel lonely. And so you are going to want to have some outlet. There are a couple of options for you in terms of how you can get supervision. You can just stay on with your supervisor that you had before on an as needed basis. I've had people do that with me. They'll, call and say, hey, I want to staff this case with you. Can we, meet for an hour and go through it? You can find or start your own group supervision. I have been in a group supervision for, I can't remember anything right now, but probably about four years or so. And it's great. We meet once a month. It's 10 other professionals. Every month somebody presents a case, and it really keeps me on my toes. What I love about that is that there are psychiatrists, psychologists, LMHTs, LMFTs, LCSWs. And I really get a wide variety of views, right? Some people are psychodynamically trained. Some people are, trained in cognitive behavioral therapy, EMDR, DBT. So we really get a good mix of people. So it might be beneficial for you to be in a mixed group for your group supervision. If you're working on something specifically, let's say you want to really become the couples counselor in your particular area, it might make sense for you to meet with, 4 or 5 other couples counselors and really freshen up on your skills that way. And so you have this cohort of people who really understand the work that you do. So I think it's really up to you what you're looking for in terms of supervision. I'm going to give you a few more tips about supervision. First, I want to thank our sponsor, TherapyNotes. So if you're looking for a platform that you can not only run your practice, write your notes, but also do your telehealth, I want you to check that out. I want you to, get on the phone with them. That's the thing that TherapyNotes really also stands apart, is their customer service. So if you're looking for an electronic health record, I really recommend TherapyNotes. So going back to supervision, I think that it's really important. I want to drive home the importance of having regular supervision, both for our clinical skills and for our own personal mental health, so that we have a way to connect with other professionals. We have a way to not feel so lonely, not feel so isolated. If you do decide to join a group practice, find out if they do offer supervision, because that's a really great, benefit. They may or may not, or they might do some, form of supervision, like again, a group supervision. If you want, again, go work with your old mentor, your old supervisor, or start up your own group supervision. You can do that virtually now. It's so easy. You can get people from across the country even. It doesn't have to be limited to your particular area. So yes, 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 keep doing supervision. I'm doing supervision. I've been licensed. Now I've been licensed. It's 11 years of being licensed, which may or may not seem like a long time. It seems like a long time, and then it seems like it went by in a blur. And I still really enjoy getting supervision. So get your supervision, keep up on your skills, and get ready to rock your private practice. I'm here most days answering your questions. I'll see you soon, everybody. Bye.